I will be discussing OHI and implementing the Intel Show Do method with my patient Norbert. I first listened and addressed all Norbert's concerns, then demonstrated a couple hygiene techniques, and then had Norbert hold a mirror to show me the techniques I went over with him to ensure that he retains the information. Norbert is a 28-year-old male whose main chief complaint today was that he has sensitive and puffy bleeding gums. After taking a couple of open-ended questions, I found out that Norbert recently just got braces 6 months ago. He stated that he brushes twice a day and stopped flossing due to not being able to get the floss through his brackets, which can be one of the reasons related to his inflamed and bleeding gums. Norbert does not like brushing his tongue at times. He recently just started using a tongue scraper because it was recommended to him by a friend, and after explaining to the patient, I noticed that he has caused some damage to his papilla. I also noticed a slight decalcification on a couple of teeth.
Norbert stated he uses a medium bristle toothbrush and that he realized it was causing him pain, so he recently switched to a soft bristle toothbrush. I told Norbert that the switch to a soft bristle toothbrush was one of the steps in helping him with sensitivity and inflamed gums. I provided a toothbrush to Norbert and asked him to show me how he brushes. He was brushing side to side and missing the top of the brackets. I explained to him that since he just recently got braces, that the way he used to brush before wouldn't work the same now since it doesn't get all the areas around the bracket. The method of toothbrush that I showed Norbert was the Charter method and a modified Bass method on his linguals. When using the Charter method, the filaments of the toothbrush are directly towards the crown of the tooth and placed at the gingival margin in an angle of 45 degrees to the long axis of the tooth using back and forth vibrating strokes. So, like this. In the Bass method, the toothbrush is at a 45-degree angle in the long axis of the tooth. This is then accompanied by small vibrating strokes followed by sweeping motion away from the gums. Tilting the toothbrush 45 degrees will help the bristles reach under the gums up to 3 millimeters. On the occlusal surface, we do side-to-side motions. So on the occlusal, we're going to do... And then on the lingual, the modified Bass.
I suggested that Norbert follow brushing with a rinse that doesn't contain ingredients, as mentioned before, potassium nitrate and fluoride to help the remineralizing sensitivity. There's a couple of good ones like Crest Pro Health, Listerine Total Care, or anything that has alcohol free with a fluoride, such as a purple Listerine bottle like this. It is anti-activity fluoride rinse, and it is also alcohol free.
I explained to Norbert that flossing with braces can be very tedious, but flossing helps reduce and prevent inflammation caused by immune response to toxins produced in the interdental biofilm. I recommended that he use a super floss, which is ideal for cleaning interproximally, especially with people with braces. The super floss, it's super easy to enter one side of the floss through the brackets and then use our index pointer fingers to get a grip, forming a C shape, hugging a tooth to go up and down. When we finish with one tooth, we come out and repeat the process on the next two teeth, keeping in mind that we never use the same section on a new tooth. So we're going to pretend this is super floss. And and we will go through the bracket, like here, getting a grip, and going up and down in the same motion. And go to the other side, and then coming out, and doing the same for the other teeth.
I then discussed which dentifrice Norbert should use to help him with sensitivity, inflamed gums, and decalcification. Norbert needs to look for toothpaste that contains potassium nitrate, which helps with sensitivity by acting as a nerve indicating, and fluoride, which helps in strengthening mineralizing teeth and is also antimicrobial. Some toothpaste I recommended was Sensodyne or Colgate Present 5000. I explained to Norbert how important tongue brushing is. Not only does it reduce the amount of bacteria organisms in the mouth that causes disease and damages to our teeth, but also reduces the cause of bad breath. Tongue brushing can be achieved by a manual toothbrush or a tongue scraper, which he is using. The only thing is that he's using too much force, causing papilla trauma. So I recommend a different type, but it has bristles like this. And then you would pretend that there's a tongue care and light pressure until you get biofilm. And then rinse off and go again until all of the biofilm is gone. I placed some disclosing solution on Norbert, and this helps show the areas he has been missing. I handed Norbert the mirror and had him show me the brushing techniques and flossing that we just discussed to ensure that the next visit his plaque score would have decreased. Once the OHI is complete, I will continue to do motivation interviewing by asking open-ended questions like, what are the first steps you would like to take to improve your oral health after today's visit? What way will you implement what I thought you did today? Do you believe everything we talked about today will benefit you in what ways? And this concludes my OHI with Norbert.